statistics from the federal government show the Beatles song, Carry That Weight, is applying to fewer Americans. But obesity numbers are still high, and today lawmakers will take a closer look at both them and weight loss drugs today on Capitol Hill. Here's ABC's Rhiannon Alley.
This morning, new figures weighing heavy on the nation's health. The CDC releasing new data showing more than 40% of adults in the U.S. are technically obese. That's slightly down from nearly 42% between 2017 and 2020, but is still higher than 37% a decade ago. With the public health concern so high, lawmakers in Washington today will weigh their options in hopes of bringing down the cost of weight loss drugs.
In terms of these very important weight loss and diabetes drugs, Ozempic and Wegovy, in some cases we are now paying 15 times more than the people in other countries.
Senator Bernie Sanders is leading a hearing today demanding answers on the pricing of the drugs.
Hundreds of thousands of people in this country who desperately need this product will not be able to afford it. There's a study that just recently came out that suggests that some 40,000 people will die unless they're able to get this drug.
The CEO of Novo Nordisk, the maker of Ozempic and Wegovy, is set to testify in person. The company stresses the massive investment in research and manufacturing for these drugs and points out more than 80% of U.S. patients with insurance coverage for Ozempic or Wegovy are paying $25 or less for each prescription. But many private insurers and Medicare don't cover weight loss drugs used for obesity.
The demand has got to be substantially lower the cost of your product and not charge us 10, 15 times what you're charging people in other countries.
Novo Nordisk recently committed $30 billion to increase manufacturing capacity for these drugs, and it spent $4 billion last year in research and development for future treatments. Rhiannon Alley, ABC News, New York.